NCLEX RN Practice Exam 2026 questions to test your performance under pressure. Question 1. Which patient should not be prescribed alendronate, Fosamax, for osteoporosis? Option A. A patient treated for high blood pressure with an ACE inhibitor. Option B. A patient who is allergic to iodine/shellfish. Option C. A patient on a calorie-restricted diet. Option D. A patient on bed rest who must maintain a supine position. The correct answer is option D. A patient on bed rest who must maintain a supine position. Fosamax requires the patient to remain upright for at least 30 minutes after ingestion to prevent severe esophageal irritation/erosion. Question 2. Which of the following strategies is not effective for the prevention of Lyme disease? Option A. Insect repellent on the skin and clothes. Option B. Long-sleeved shirts and long pants. Option C. Prophylactic antibiotic therapy prior to anticipated exposure. Option D. Careful examination of skin and hair for ticks. The correct answer is option C. Prophylactic antibiotic therapy prior to anticipated exposure. Prophylactic antibiotics are not routinely given before an exposure. Prevention focuses on avoiding tick bites and prompt removal. Question 3. Which of the following indicates the need for discontinuation of N4 line? Option A. The patient complains of pain from movement. Option B. The area proximal to the site is reddened, warm, and painful. Option C. The 4 solution is infusing too slowly when the limb is elevated. Option D. A hematoma is visible in the area of the 4 insertion site. The correct answer is option B. The area proximal to the site is reddened, warm, and painful. Redness, warmth, and pain, phlebitis, require the immediate removal of the 4 to prevent further vein irritation or infection. Question 4. A patient sitting up in bed is dyspneic with crackles in both lung bases after receiving 2 units of blood. Which complication is most likely? Option A. Febrile non-hemolytic reaction. Option B. Allergic transfusion reaction. Option C. Acute hemolytic reaction. Option D. Fluid overload. The correct answer is option D. Fluid overload. Crackles in the lungs and dyspnea are classic signs of transfusion-associated circulatory overload, TACO, or fluid overload. Question 5. A patient in labor has just received an amniotomy. Which of the following is correct regarding this procedure? Select all that apply. Option A. Frequent checks for cervical dilation are needed. Option B. Contractions may become stronger and closer together. Option C. The FHR will be followed closely due to potential cord compression. Option D. The procedure is followed by a gush of amniotic fluid. The correct answer is option C. The FHR will be followed closely due to potential cord compression. After an amniotomy, AROM, the primary nursing priority is monitoring fetal heart rate to detect cord compression or prolapse. Question 6. Which instruction regarding a newborn with hyperbilirubinemia is not correct? Option A. Continue to breastfeed frequently. Option B. Follow up with a physician within 72 hours. Option C. Watch for signs of dehydration. Option D. Keep the baby quiet, swaddled, and in a dimly lit area. The correct answer is option D. Keep the baby quiet, swaddled, and in a dimly lit area. Infants with jaundice need exposure to light, natural or phototherapy, to help break down bilirubin. A dimly lit area is counterproductive. Question 7. Which instruction should the nurse provide regarding car safety for a healthy newborn trip home? Option A. Restrained in a car seat, in the back seat, rear facing. Option B. Restrained in a car seat, in the front passenger seat. Option C. Restrained in a car seat facing forward in the back seat. Option D. The parent may sit in the back seat and hold the newborn. The correct answer is option A. Restrained in a car seat, in the back seat, rear facing. Safety standards require newborns to be in a rear-facing car seat in the back seat of the vehicle. Question 8. A nurse is administering 4-furosemide to a patient with CHF. After the infusion, which symptom is not expected? Option A. Increased urinary output. Option B. Decreased edema. Option C. Decreased pain. Option D. Decreased blood pressure. The correct answer is option C, decreased pain. Furosemide is a diuretic used to reduce fluid volume. It has no direct analgesic properties to decrease pain. Question 9. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Option A, obesity. Option B, heredity. Option C, gender. Option D, age. The correct answer is option A, obesity. Obesity is modifiable through diet and exercise, whereas heredity, gender, and age are non-modifiable risk factors.